Hi, I'm Dr. Chris Steffes, General Surgeon with Henry Ford Sports Medicine, here to talk about sports hernias. Hernias are holes in the abdominal wall. Sports hernias don't actually have a hole. So there's a difference between a regular hernia and a sports hernia. This is commonly misdiagnosed and commonly confused amongst doctors and trainers amongst young athletes. When an athlete has pain in the groin area, we suspect that there's a hernia, but it may just be a sports hernia, which is better termed a tear, or what we call pubic myalgia, which is just a painful muscle. Treatment for a sports hernia usually starts with rest, ice, heat, stretching, and other conservative measures. In cases where the sports hernia persists for months at a time, surgery may be necessary. However, surgery will leave the athlete debilitated for quite some period of time, so it has to be carefully considered and again discussed with a general surgeon. I'm Dr. Chris Steffes, General Surgeon with the Henry Ford Sports Medicine team.
Download our sports medicine app and learn more at henryford.com/sports.
The Sports Medicine Minute is presented by Henry Ford Sports Medicine. Together, we can.